Thank you, Ron. Well, September is Prostate Cancer Awareness Month, and we are happy to have Jim Eisenhood back with us this morning to discuss the importance of early detection and testing and what those PSA numbers actually mean. Plus, he has added a second edition to his book, Prostate Cancer and Radiation. This he wrote because of his journey to beating cancer, right, Jim?
Absolutely, absolutely.
And we're going to talk a little more about this here in a minute. But before we came out, you and I were talking, and we were like, just having this conversation for men isn't always easy for them, but it's what you think is important. And like you told me, there's so much that people don't realize.
Yeah, it really is. And, you know, we have Prostate Cancer Awareness Month, and people aren't really aware of that.
Right.
1 in 8 men at some point in their life will get prostate cancer. This may surprise you also, Stacey. October's breast cancer awareness,
which we hear a lot about.
1 in 8 women. It's virtually the same as what you have for men. And if you statistically looked at it in a percentage, men are more likely to get prostate cancer than women will get breast cancer.
So very important that we continue to bring awareness about this and also talk about the importance of early detection. That's really the key. There are ways that we can detect this early, and our outlook is much better. So let's talk about early detection.
Well, that is absolutely the thing, to catch it early. Doctors will start doing testing at 40 years old, but it's the digital manual test.
Right.
At 50 years old, you should start getting a PSA blood test, which is a very good way of tracking to see that the potential of cancer may be there. If you are at risk, you should be getting it earlier. And at risk would be that somebody in your family has prostate cancer.
Yeah, that history.
African Americans have a much greater chance of prostate cancer, so they should start getting tested earlier as well.
And that's that PSA number. And you know, we hear, oh, it's normal, it's not normal, but it doesn't just come down to that.
No, it doesn't. You need to know your numbers. That's the key I keep telling people. They'll say, hey, Jim, I went and got tested. I said, well, what was your number? Well, the doctor said it was good.
Okay.
I said, no, what was your number?
Right.
Well, I don't know, because you need to watch it.
Okay.
A lot of times the doctors will look and say it's in the normal range, so it's good. But you can still have prostate cancer even in the normal range. And I've actually heard of a gentleman or two that have had stage 4 when it was in the normal range. So you know your number, and you track it from year to year. And if you see it go up 0.7, 0.75 in a year, you ask your doctor, test me again in 3 months.
Okay, more often than more frequently.
Let's see if we have a pattern. Is this going up again? If it is, maybe it's suspicious and we need to deal with it.
Something to kind of track. Also, we hear, you know, a lot of doctors stop testing after the age of 70 because they assume it's slow growing. Not always necessarily the case.
And I'll give you a prime example of that. They do stop testing at about 70, 75, a lot of doctors. Some will do more than that. I have somebody very, very close to me that they stopped testing, and his PSA was 0.5. And then I was going through cancer treatment. He was losing weight. And they forced the doctor to do a PSA test, and it had only been 2 years. His PSA was 115, and he was stage 4. And he just passed away this last March after about 1.5 years. So my advice is tell the doctor to keep testing. If your insurance won't pay for it yourself. It's about $20, $25 test.
Right, so not too much for the information that you could get. So you've added some things to this book. Real quick, tell everybody what you've added to your book for the second edition.
I added a chapter on BPH, which is benign prostatic hyperplasia. A lot of times they call it enlarged prostate. 50% of men by 60 years old will have a form of that. By 85, it's like 90%. Okay. And you may not have symptoms, and it's a non-cancerous condition. So I had a lot of people ask me, what kind of testing is there for? What kind of treatment can you do? So I wrote a chapter on that. Then I also had a scare of recurrence. And so I wrote a chapter called PSA bounce, or BCR, which is biochemical recurrence. And in my case, it turned out to be a benign bounce.
Good.
Which is normally the case, but my bounce went up so much that all of my doctors really, they were a
little concerned.
They were stunned about it. I went through a lot of testing after that and find out. But with radiation, and I'll say this real quick because I know you don't have a lot of time, but when you have radiation treatment, it's not unusual to have a bounce.
Well, that's good to know.
But now there's higher dose radiations. I had HDR brachytherapy along with regular, which is higher dose, and there's an SBRT. I have done research that's found that with high dose radiation, those bounces are much more pronounced. And a lot of the doctors have not necessarily seen that, which is what I had. So when it turned out I'm good, I'm now down to 0.92. Good. I don't say remission, I just say I'm not active at this point.
So we're glad to hear that, and we're always glad to have you in. How can people get your book?
It is on Amazon. Just do a search on Amazon for prostate cancer and radiation and my name, and you can find it up there.
There you go. Thank you, Jim, as always.
Thank you very much for having me.
And we'll be back. We've got more local lifestyles right after this.